Hi, my name is Diana, and today we're going to talk about the diaphragm. So, the diaphragm is a form of birth control that is a shallow cup shaped like a little saucer and made of very soft silicone. It helps to prevent pregnancy by working as a barrier. However, in order for the diaphragm to be most effective, you must add spermicide. Spermicide is a cream or a gel that kills sperm and must be added to the diaphragm before it's inserted into the vagina. For the most part, using a diaphragm is fairly easy once you get the hang of it. It will take some practice, but your nurse or doctor will give you instructions on how to exactly use it. To start off, you must make sure to wash your hands with soap and water. Next, you must put the spermicide in the diaphragm. After you put the spermicide, you must get into a comfortable position, similar to the position you use to insert a tampon. You also have to separate the lips of your vulva with one hand. You can use the other hand to pinch the rim of the diaphragm together to fold it in half, making it easier to insert. To assure it is secure, the diaphragm must be behind your pubic bone and make sure your cervix is covered. Taking the diaphragm out is easier than putting it in. All you have to do is relax, insert your fingers, and gently pull the diaphragm down and out. Once it is out, you can take care of your diaphragm by washing it with soap and warm water after every use. You must also make sure to let it air dry and be careful to not use any kinds of powders. Store the diaphragm in a clean place away from extreme heat. Also, make sure that you are always checking for holes, cracks, wrinkles, and test for leaks. Now we are going to go over Now we are going to go over some stats when it comes to the effectiveness of diaphragms. When used perfectly, the diaphragm is 94% effective. However, we are only human and we can't always do things perfectly, so in real life, the diaphragms are only 84% effective. This means that out of 100 people, 13 will get pregnant every year when using a diaphragm. If you want to increase the effectiveness of the diaphragm, you must use it every time you have sex. This includes using the spermicide with the diaphragm. You must also put your diaphragm in before you decide to have sex and make sure that it covers your cervix. To increase the effectiveness even more, you can use a secondary method of contraceptive like the withdrawal method or condoms. When it comes to the cost, it may range from $0 to $250 per diaphragm. The spermicide is about $5 to $15 a kit. You are able to get the diaphragm for free with insurance. But if you are low income, you can also use Medicaid or Planned Parenthood to obtain the diaphragm. Where can you obtain the diaphragm? You can either get the diaphragm from a pharmacy, drugstore, and even a health center, but you must first get it prescribed. The reason for this is that you need to get the diaphragm fitted at a doctor's office. The spermicide, however, is available at any drugstore due to the fact that it does not require a prescription. Some advantages are that the diaphragm is small, so it fits anywhere. It is also effective as soon as you start using it, and you may insert it 2 hours before having sex and leave it in for 6 hours after having sex. Most users can't even feel it. Plus, it does not have any hormones. Lastly, it also lasts a long time compared to other barrier methods like condoms. So some disadvantages are that you are required to use it every single time you engage in sex. Spermicide may also have some side effects, which can cause vaginal irritation. They also don't protect against STIs, and the size of diaphragms matter, so you might have to get your diaphragm refitted if anything in your body changes. In conclusion, There are so many types of contraceptives out there, you have to make sure that when choosing one, it is the right one for you. This is why we made the diaphragm available for women all over the world. Now it's your turn to decide, is the diaphragm the right choice for you?